And they may also be called drugs, but it is not all drugs that are medicines, but medicines can be drugs. Drugs, kuna zile zinakuaga na negative effect on our bodies. That is why they are not called over-the-counter drugs. Kuna drugs zenye tunajua, zile maybe they can be abused, like cocaine, bado they are drugs. Madawa za kulevya, hizo ni drugs pia, but still drugs, we can still refer medicine as drugs because they also have a positive effect. Drugs, they are those drugs still, they have positive effect on our bodies, but drugs pia zina include those that do have a negative effect on our bodies. That is why mostly we are referring them as medicines because they'll have a positive effect on our bodies. Tukikunywa zitatusaidia, they will heal the diseases, they relieve the pain. That is why we are calling them medicines. So this morning, I want to give you the examples of some of over-the-counter medicines that we have, maybe that are allowed to be sold over the counter. Maybe you can get maybe the painkillers, the medicines for cough syrups, for flu, cold, allergies, maybe for constipation, for heartburns, multivitamins. Those are some of the medicines that we can get over the counter without necessarily going to the doctor to get a prescription. And maybe it is an advantage because maybe you don't need to go for the prescription. Najua maybe here in our country, kwenda kwa daktari inakugharimu, maybe you need the consultation fee. But maybe with the over-the-counter medications, uta need to walk in a pharmacy, then you ask what you need. Maybe if it is a painkiller or maybe ni dawa ya homa, utaingia kwa chemist na uitishe na uuziwe. There are also those drugs that are not allowed to be sold over the counter. Mostly they are the antibiotics and maybe other drugs that are in that category. But mostly here, because we are sisi tumezoea sana kwenda kwa chemist, tunaenda kuitisha antibiotic, tunajuaga hiyo ni over the counter medicine. Today I want you to know that antibiotics, they are not over the counter medicines. Even the simplest, they are Moxil. It is supposed to be sold with a prescription. Lakini sasa because of our setup, and maybe because the government cannot be able to go around maybe knowing what everybody is doing in their premise, how tutaweza maybe to control some of these things. Though even if they will be sold to you, maybe you go, uko na chest pain, maybe you have that sore throat, you're given an antibiotic, itakutibu kweli. But the reason why these antibiotics are so controlled, it is because maybe of the abuse. And once you abuse these drugs, zina resort to failure of treatment. Eventually, maybe with time, zinakuwa resistant, such that sasa maybe ukienda kwa duka, uitishe ya Moxil, maybe with a simple, maybe that chest pain, if these drugs become resistant, haitakutibu. So itabidi tu naendea zile dawa zenye ziko juu kidogo. As in now, this is a simpler drug, itabidi now you go to a higher class of antibiotic. That is why they are controlled. But nimewaambia because maybe of our setup here, our country, some of the things that maybe they are sold over the counter, it is not very possible to control what people are doing in the chemists. So at least I have defined to you what over-the-counter medicine is and prescription medication is. So I've said that this is what the government has allowed to be sold to the general public because they have less side effects. When I say less side effects, it doesn't mean that if you maybe do overdose, they will not harm you. They will still harm you. They still have that capacity to harm you. So you are supposed to take medication as per the dosage guideline, meaning that ukiambiwa tembe meza moja mara tatu, that is, hiyo inamaanishaga within 1 day, and 1 day is 24 hours, unafaa kuwa umemeza hiyo dawa mara tatu kwa siku, after every 8 hours. Such that asubuhi na mchana na jioni, hiyo itakuwa mara tatu, and that is supposed to be after every 8 hours. If you're given a medicine and you're told that you're supposed to take 2 times a day, it is supposed to be within 24 hours, and it will be after every 12 hours. Ndio maana unaambiwa, so hiyo utaambiwa ukunywe asubuhi na jioni, itakuwa baada ya masaa 12. Hiyo ni asubuhi na jioni. Kuna zile pia, a common medicine, maybe it is an antibiotic, na sana sana inapeagwa watoto wadogo, and even maybe the adults, maybe for tonsillitis, ama maybe mtu akiwa na cut ama wound, kuna dawa unapeagwa, unaambiwa ukunywe 4 times a day. So 4 times a day is after every 6 hours. Maybe unaweza kwa advice, take 6 in the morning, then midday, then 6 in the evening, then maybe at around 11 when you're going to bed. That will be 4 times a day. So it is very crucial for you to take medications the way you've been told to take them. If you have been told that take your medicine after food, most of these medications, kuna zingine ziko na kitu tunaitaga gastric effect. Like ukikunywa zitakudhuru kwa sababu maybe zitakuchoma tumbo, maybe zitafanya maybe acid yako iende juu sana, so you're told to take them after meals. Kuna zile zenye utaambiwa take them like an hour before meals, maybe because they will be affected by the food. Unajua kuna zile vitu najua details zenye we don't really take note of when we are being given medication. Unaambiagwa tu meza moja mara 3, you don't even know, are you supposed to take them after food or before food? Ama unafaa kuzikunywa what time? It is good to take note of what you've been advised to take those medications because they work better if you take them like that. So now I come back to over-the-counter medications. Hizi dawa, maybe when you go to the chemist, kuna yule mtu, okay fine, like kawaida, utapata homa, utapata flu, utapata maybe constipation, diarrhea, you can just go and ask for this medication. But kuna zile, the special populations, wenye wanafaa kujua, when you go to the chemist, you cannot get just any medication for over-the-counter medicines. Like let's say, wale watu wenye wako na ulcers. Maybe if you have a complication with the ulcers, hawezi enda kuitisha tu dawa kama diclofenac. Diclofenac watu wengi wanajua kwa sababu maybe ni ya uchungu ya joints, arthritis or such. Because diclofenac, it will worsen your condition. Like maybe it can even lead to bleeding or maybe perforation of the wound. So when you're going to get the drug for over-the-counter medicine, that is what is allowed to be sold to the public. Make sure if you have maybe an underlying condition, you make the person who is selling the medicines to you to know that maybe uko na shida ingine, maybe uko nayo, so that they can give you the most suitable drugs for that, because there are those suitable painkillers for that you need to take, especially maybe if you have those maybe those complications for hyperacidity, for ulcers, you can be advised better. There's also people who have maybe our parents, those who have hypertension, those who have diabetes. For those, I would say that they are supposed to take the medications that have been given to them by their doctors. And if they would like to go and get medication for over-the-counter, it is what the doctor has advised them to take. Because already they have other medications that they are taking. Na kuna kitu ingine, there's something that is called maybe interaction of medications. Maybe they can be given something, maybe aende kwa chemist, aende aitishe maybe a certain medicine, and it can interact with what they are already taking. That is what they are already on. That is why they're supposed to be very keen when they're going to ask for medicine, for over-the-counter medicine. They can only take what has been advised to them by their doctors to take. Sio ile kitu yenye utaenda kwa pharmacy useme niko na kahoma, give me this, especially even diabetes, because now even like the cough syrups, they have so much sugar. There are those that are not recommended. It's not just any other cough syrup that a diabetic patient can take in a chemist. So ukishaenda kwa chemist pale, ni lazima ukuwe unajua, if you have an underlying condition, you have to know that you're going to take the right medication, maybe to avoid these interactions, and maybe to avoid maybe other medication getting toxic to the body. Juu kuna zingine zinaenda zinafunga zingine kukua metabolized, that is the way zinatolewa kwa mwili. So by the end of the day, maybe the concentration of that medicine becomes high in the blood, mpaka unakuwa maybe itakuwa toxic to the body. So you're not supposed. So what I'm emphasizing is, when you know that you have an underlying condition, just make sure that what you're getting is safe for you. I also want to say that there are also these, maybe our young team, maybe the newlywed, those who are our mothers, our expectant mothers. You're also not supposed just to go and get any other medication from the counter, because most of the medicines, they affect the baby when the baby is growing in the stomach. especially what we call the first trimester, ni miezi mbele ya 3 ya huyo mtoto saa ile anakuwa kwa tumbo, and the second trimester hufai kwenda tu kwa chemist uende useme ati nataka dawa and you're not disclosing that you're expectant, because most of these drugs, they affect the growth of the baby, and there are even those that can form deformities to the baby. So you're supposed to be very keen. You're supposed to maybe to follow your clinics so that you can go and be advised. If it is that you're getting sick, you're supposed to go and seek medical advice. Don't go to the chemist and buy medicines over the counter. I also want us to take note of the young babies, watoto wadogo, maybe for below 2 years. It is not very advisable to buy for them drugs over the counter. Huyu mtoto anafaa kupelekwa kwa daktari, aende aonekane, because when they are still young, that is when maybe the doctor can be able to know maybe if there's a concern, ama kuna kitu huyu mtoto chenye anakosa kwa mwili, ama there's something that this baby needs. So it's not very advisable for mothers. Please don't take and wacha kwenda kununulia mtoto wa below 2 years dawa kwa chemist. Hata generally even babies who are below 5 years, ukiona maybe akona kahoma, umemnunulia dawa hata hakaishi, it's always good like to seek medical advice if it is not improving. Whatever it is, maybe you're doing to that baby. If it is not improving, really seek medical advice. And even for adults, kama unajua maybe umekuwa na shida fulani, maybe it's a headache, maybe it's a stomachache, you usually take maybe the painkillers, inatulia kidogo, then after some time it is back. You're also advised to seek medical advice, because it could be there's something else that is not being captured at the pharmacy level, that you need to go to the hospital for further investigations, ndio maybe daktari ajue kama kuna shida ingine. So tusione kama tena ni mzigo sana. Maybe, I know it is a shortcut, it is good, and that is why it is there, maybe the pharmacies, because now it has become like our other hospitals, the pharmacies. But please make sure that if it is something that has been persistent, usikae ati ukisema ati nao hii na kunywaga inanituliza, so I have to go every other time and get what inanituliza. Uje tu unatuliza, maybe yes it is true unatuliza, but it could be there's something else that is not the hospital to see a doctor to do further investigations, ndio aone kama kuna shida ingine. There's something that I would like also to maybe notify you. It's a question maybe I got yesterday from one of us. Maybe to the pharmacy outside there, you already have some medicine you're taking, and then maybe or because for over-the-counter medicine, unakuwaga allowed, you choose what you want to get from the counter, like you're independent. That I want this cough syrup, this is what I want, this is what treats my cough. But when you go to the chemist, mtu anakuambia, apana, no, this is not best for you. I want to give you something better. So this is quite often in our chemists. So what I would advise you today is that if you surely know what you usually take, and then maybe it is a painkiller for the headache, umeenda with a headache, you go ask for a Panadol. Maybe Panadol Advance works better for me. But I also have a knee pain. I also have maybe nimelala vibaya, maybe ni nasikia shingo inauma, ama pia magoti pia inaniuma, apart from now the headache. Then someone tells you, no, Panadol will not work better for you. Let me give you something else. Sure, they could be, because now you have a knee pain, a Panadol, it's not the most suitable type of painkiller for that knee pain. So could be, anataka kukuongezea something else, maybe, that will cover something called that is inflammation for that, of which it is still okay. But what I will tell you is that let that person explain to you the reasons why anataka kukuchenjia hiyo dawa. Like, ni kwa nini sitaki kupatia hiyo option yenye umekuja nayo. Because now they have been trained, they are capable, they know why they are giving you that medication. They should explain to you why they want to give you another option apart from what you are willing to get. It could be, it will be better for you because maybe if they give you something like Panadol, it's for the headache, then give you something like diclofenac, it will cater for and there are those medicines that are usually combined, 1 or 2 medication, or even 3, that have maybe a muscle relaxant that can take care of the pain better. So that is still okay. Then again, maybe you have a baby who needs like something like maybe you just want to get Piriton. But according to how you have maybe presented the case for the baby, maybe umeenda ukamwambia mtoto wangu amefungana sana, amekuwa na homa, running nose, I just need a Piriton. But now they advise you, they tell you now you need still something, maybe we can top up something like normal saline drops. Maybe normal saline will still help with the decongesting the nostrils, so that is still okay. But if they're willing to add that medication for you, let them explain why they are doing that for you. That will be okay. What I don't agree with is if you go to the hospital, then you're given a prescription by the doctor and you're told to take this medicine. Then you take it for around 2 or 3 days or 4 days, discover you're not improving. Then the other option is you go to a chemist. No, that is wrong. So what you're supposed to do, you're supposed to go back either to the doctor who saw you, because now the doctor, ataona, like the records, if there were investigations that were done, atajua, and then maybe ataona, maybe are there more investigations that I need to do? Because maybe it could be there's something that I'm missing. So if you're coming from the doctor and you feel that daktari hakukutibu vizuri, it's also good even to seek maybe, even if it is another hospital, you can still go to another hospital. Lakini sasa ukienda kwa chemist anaweza kuambia tu hapana, achana na hizo dawa. No, nobody is supposed to overrule a prescription. Like ile umeenda nayo, umepresent, like this is the doctor's prescription. Nobody is supposed to overrule that. If I'm in the pharmacy, I'm selling medicine. If you come with a prescription, I did not see you. It is the doctor who saw you, and they saw the need of you to have the medication. So that is why you're supposed to go and take that medication. And if it is not working for you, please go back to the doctor. Maybe they can do more investigations. Or maybe if you're not comfortable with that doctor, you can still change the doctors and you go somewhere else and be seen by another doctor. So now I would like to talk about the counseling tips for safe use of OTC, or over-the-counter medication. So what you need to do, if you're not sure, you seek guidance. If you're in doubt of whatever medication that you've been given. I've also talked about pre-existing conditions. Maybe you have to tell the person who is giving medication if you have any pre-existing condition. Also the pediatric patients, there are those drugs that are not supposed to be given to children. There are those that are contraindicated, so children should get the right medication. I've also talked of the proper dosage, like you do not guess the dosage, just take the right dosage and you take at the right time. I also want to talk something about maybe even storage of the medication. There are those who are using the insulin. There are those who are given the fridge items, like the antibiotics. You're supposed to store them in the fridge. Also, just take note of the route of administration. Wherever you've been told to use the medication, they work better if you follow the right route of drug administration. Never exceed the recommended dosage. Just take what you've been advised to take. Especially wale watu wanaendaga kuchukua cough syrups, they are very sweet. So, ukikunywa siku ya kwanza, usikie kama haikufanyi, you've been told to take the 10 ml, unasikia bado hiyo cough yangu haijaenda. So actually you just take it like kama uji. So please don't do that. It is dangerous. Just take what has been prescribed. That is the right medication, and that is the right dosage. Because medicines, when they get into your body, they also need to be metabolized. And they also need to be at the right dosage in your body. Kwa sababu ukifanya excess of what you're supposed to do, unaweza kuwa unatampa na your internal organs, something like the liver, that is supposed to maybe metabolize that drug ndio itoke kwa mwili. So whenever you're told, like just take 10 ml or 15 ml or 5 ml, that should be the right dosage that you're supposed to take for that specific medication. Also, those mothers who are breastfeeding, there are also those drugs that usually cross to the breast milk. So even when you're getting the over-the-counter medications, kindly make sure that you're notifying the person who is selling to you that you are breastfeeding. So the benefits of over-the-counter drugs, they are easy and quick to access. There's the diverse availability. There's the lower healthcare cost that you don't need to see the doctor. And it enables the patient to select for what they need. The various treatment options they have, and they get what they need. So you use them when you have minor health problems. That is when you use the over-the-counter medications. When you have the minor health problems, e.g. maybe the headache, cough, I had explained earlier, the pain, the flu, the diarrhea, loss of appetite, the allergics, the constipation, and even the heartburn. So then let's get to the difference I have tried to explain about the over-the-counter and the prescriptions-only medicines. I've said that over-the-counter you can get without a prescription. For the prescription medicine, you need to get a prescription from the doctor. So let's go to dangers of self-medication. Now, these are the the disadvantages of self-medicating, like what we are doing when you're going to the pharmacy to get this medicine. So one is the inaccurate diagnosis. What I've said is that maybe when you usually get symptoms, Sahi, you have the symptoms, you take the painkiller, they relieve, and then again next month you take, you still feel the same, you go buy the medicines for relieving the pain. You see, like it becomes like a continuous thing. You can have inaccurate diagnosis ya kwamba haupati kwa ukweli ile kitu inakusumbua. That is when now you're supposed to go and seek medical advice, so that maybe if there are any investigations that need to be done, they can be done so that you can get the accurate diagnosis. It also trickles down to delayed diagnosis. Delayed diagnosis will worsen the ailment. Like we know, maybe if you, diseases like cancer, if you can be able if they can be detected earlier, they can be managed. But maybe if you go to late stage, it becomes difficult to manage them. So the earlier you get the diagnosis, the better the management. Maybe adverse drug reactions. Hizi sasa ni kama allergies. Maybe you don't know whether you have an allergy to a certain drugs. Then you go to the pharmacy, unaitisha tu, and then you get allergies. Or maybe they're called adverse, like what is not expected to happen to your body. Like ukikunywa hiyo dawa, huko unajua kuna shida hiyo dawa itakupatia. Those are the adverse drug reactions. There's also increased drug resistance. Na hiyo nime-explain na antibiotics, that is why they are controlled. So that maybe the government can be able to capture this, so there's no drug resistance. Ndio dawa zinakuwa effective, like the antibiotics. Dangerous drug interactions ni kama hizo nimewaambia, maybe mtu ako na underlying condition, and you go to the pharmacy, maybe you don't say that you have other medications that you're taking, then you just, you're given a drug that can interact with whatever you're taking. Hata wale watu wanachukuaga madawa za herbal medicine, you're still not supposed to be on herbal and still on other medication. You're supposed to be on either. You cannot be on both. Unless maybe the doctor who is treating you knows exactly what you're taking for herbal. That is when you can be able to go on the other side because of these interactions. Also, incorrect manner of administration. Hii ni kama labda kuna dawa mbili zinafaa kukuwa zina interact, and their timing inakuwa hautaweza kuzikunywa. Like maybe you just buy this today, you buy another one tomorrow, and you just continue taking them together. Kama haujui, one is interacting with the other. It could be moja ita inhibit the other one, it won't work. Ama maybe moja inhibit the other one, itakuwa maybe elevated levels of the drug in the body, so inakuwa toxic. So we go next. There's a incorrect dosage. Hii ni ile maybe unachukuaga tu maybe diclofenac, unachukuaga tu diclofenac kamoja unakunywa sahi, after around 4 hours kama pain haijaisha, you just go again and get another diclofenac, and maybe what you were to take was supposed to be a tablet once a day, because like for diclofenac, the simplest medication maybe I can explain with, this is what we call a diclofenac slow release. This is around 100 mg, and you're supposed to just one a day. It's enough. But now maybe after around 8 hours, you feel like the pain is not going, you go and take another tablet. That is not allowed. maybe incorrect choice of therapy, maybe ni vile tu maybe we unajisikia, but maybe whatever you go pick from the counter, it could be wrong for what you're feeling. So the safety tips for over-the-counter medications, you're supposed to keep the original container with the label to avoid forgetting the dosage. Ile dawa ama ile karatasi yenye uliandikiwa juu ya hiyo dawa, if it is a painkiller, just make sure that you still have maybe the label with you, so that maybe leo hutakunywa 1 tablet, the other time ukunywe zikiwa 2, the other time hata ukumbuki zilikuwa mara 2 ama mara 3. You're supposed to retain the container so that you can be able to get the dosage. Then again, usiekage dawa sana, because also drugs have expiry dates, because you didn't even know what was sold for you ilikuwa ina expire lini. So it's good, like when you're getting over-the-counter medicines, just get for what can be able to sort you out at that particular time. You take the right dosage. Don't mix medicines, usizichanganishane pamoja, wacha kila dawa ikae kivyake ndio usikue confused. So store them properly in a cool, dry place, not in the kitchen where maybe temperatures can rise. You're supposed to store them in a normal room temperature, maybe up to 25 degrees to 28 degrees. Fridge items, weka kwa fridge, zile zenye umeambiwa, maybe those people with insulin, but maybe insulin, those who are people who are using insulin, those are who are diabetic. Maybe if you're using like a pen or maybe that vial for injecting, it is safe to keep it for 1 month in the room temperature. But if you have more than 2 pens or more than 2 insulins, you're advised to keep one in the fridge, so that whatever you're not using, you maybe keep it on the room temperature. So over-the-counter drugs, they can be given by the doctor still, because it is still the same medicine that will cater for, maybe for pain. If you go to the doctor, if you're used into taking the diclofenac or maybe something like Brufen, the doctor can still give you the over-the-counter medicine plus whatever other medicine the doctor will give you, because it's still something that will take care of the pain that you have. It's not that this doctor is not incompetent, but maybe these are the drugs that will still take care of the pain that you're having. So hata ukienda kwa hospitali uone tu umepewa Panadol, usianze kuona kama huyo daktari amekudharau ama sijui amekupatia dawa simple, because sometimes that is our mentality, ati umepewa dawa gani sasa. No, that is still a painkiller. If you have the fever, if you have the pain, if you have maybe inflammation, Panadol, diclofenac, or all those painkillers, they will take care of that. And those are like the first line, as in the doctor doesn't need to use a complicated medication to you if it is the first time you're going to the hospital. So this is still okay if the doctor gives you those drugs. So maybe I just explained to you some few, maybe the routes of drug administration. Maybe this could be an overview. There are those that are oral, zile zenye unameza, na hizi ndio kila mtu labda tunazijua sana. Kuna zile zinaitwa sublingual. Hiyo dawa unafaa kuwekwa kwa ulimi hapa chini, but mostly those are for the hospital use. Hizo labda ni saa ile maybe mtu ako na cardiac arrest, it's very easy, like it's fast in acting. So when it is placed under your tongue, it goes directly to the system, so it works better. There are those that are called, zile za kudungwa tunazitaga either intramuscular or intravenous. Intramuscular ni yenye utadungwa kwa muscle, intravenous ni yenye itawekwa kwa vein, yenye unaambiwa utawekwa kwa mshipa wa damu. Subcutaneous ni ile tu kama ya insulin just below the skin. Then there's zingine that are called rectal, maybe for those people with hemorrhoids. Na kuna zile zenye pia utaambiwa, okay fine, I know some things they are really not very comfortable maybe when using, maybe even for the ladies. Kuna zile dawa maybe utaambiwa maybe for this, maybe you need to do them, maybe unafaa kuzieka maybe kwa njia ya uzazi. It is not easy, and don't tell the doctor to inject you. These drugs are supposed to work locally, like how vile umeambiwa uziweke, that is where they are supposed to act. That is where there are no injections for that. So if you're supposed, maybe you have the hemorrhoids, you're supposed to insert a suppository, or maybe you're uzazi, just do that because that is how it is going to work. Haiwezi work any other way. There are those topical, like the creams, they are transdermal, like the patch, kuna zile za kuweka, maybe kuna hizo za maybe za wamama za upangaji wa uzazi, na pia maybe the patch for nicotine, wale watu wamelemewa na sigara, pia there's that transdermal. So now I also want to remind you, maybe those drugs, the specifications for taking drugs, like those, when you, maybe those people who have hypertensive drugs, ni hizi dawa za pressure. Maybe, I think there's most of the people, maybe according to how you discussed with the doctor, they are most suitably taken in the morning. Because in the morning, you're waking up and you're getting busy with your daily chores. That is when maybe the pressure, it tends to rise. I think there are maybe our parents, our old parents, those who are on these medications, they really don't know how maybe, or the right time when they are supposed to be taken. So they're supposed to be taken in the morning, because during the day, that is when you're a bit active, unless maybe the doctor has advised you to take them in the evening, because maybe you have other medications you're taking, and maybe you've been having these medicines for long, and they're still working for you. Maybe for those who have maybe the sugars or the diabetes, okay, those they have different timings. There are those that you're supposed to take with your meals, so that maybe they can lower the blood sugar. There are those that are like you're told to take them with meals. There are those that are supposed maybe to be taken like 30 minutes earlier, maybe in the morning, before breakfast. You should know exactly what medication, because there are so many, you should know exactly what you're supposed to be taking and at what time are you supposed to be taking, because they will work better if you take them the right way. So I think I don't have much. I don't know whether there's anybody who have a question. But what I want to say is that God is our healer. And for truth, he's the healer of all of our diseases. But he has also given doctors the knowledge. That is why they are there, maybe to take care of maybe those complications that we have. But you know, by the end of the day, doctors treat, but God heals. Is that not true? Yeah, thank you so much. I've come to the end of my presentation. Maybe if you have a question, anybody with a question?
My question is, maybe I have this problem, or maybe I am sick, and maybe there is a medication I normally use, and it helps me. And maybe I have gone to the doctor, and he does the prescription of another medicine. Will I be wrong to ask the doctor maybe to give me the medicine which I am used to? Because I have experienced that with a certain gent, anaenda kwa daktari, anasema mimi huwa natumia hii, nipatie hii.
Okay, okay, when you go to the doctor is supposed to know you are on which medication. And if surely that is what is working for you, the doctor is supposed, okay, fine, I won't say that it is a must. That will be according to the doctor's judgment. Anafaa kukupatia what works for you. If it is something that has been working for you, you can just talk to the doctor, then daktari ataona at that particular time, ama akwambie, because you've been using this medicine for some time, let us try something else. Anaweza kukuadvise hivyo. But if it is something that has been working for you, hakuna shida. Daktari tu can still continue with the same medication, ama akwambie, sasa naona kama tunaweza switch to these other, because there are so many medications for the same ailment. Anaweza kukwambia, kwa sababu umekuwa ukitumia hii, let us see if this other one can work better than what you're using. But there's no harm.
Thank you, Madam. I first want to affirm what you have said about the medication from the counter is bad. But we also have a problem as a church, because we have a healthy group, which is in the church. And not all of you who are doctors or medics. But some are taking the medication or they are giving medications to maybe the children. When we have a problem there and you ask somebody from the health, they end up giving some painkillers, which is not wrong, but hawana hiyo ujuaji kabisa, ile kuelewa kabisa ni dawa inatoshanaje, inatakiwa kupewa mtoto wa miaka fulani. And even as teachers, we are not trained about that. So as healthy group, kindly help us. Again, I know for doctors to mention about herbal is it's rather not right, but can you advise us as a church? Because most people nowadays are going to the herbal and they are mixing the herbal with the medicines they are given from the hospitals. So what would you advise us as the church about those herbal medicines where most of the people, they just start a business, miti ni dawa na tunaanza kukunywa na tunasema it's doing better. On that, I would like you to tell us whether it is good, and again, zinawaka aje zikiwa mbili? How do they work when they are mixed together?
Okay, thank you for those two questions. Yeah, they're very crucial. I would say that maybe, I understand that maybe you could not be having someone from the maybe health sector per se to help you with maybe with the kids. But what I would say is that even if you have maybe a painkiller that you want to give, and maybe it's a baby who has a headache, and it is in the church that you want to give, kindly there are inserts in that medication. Usipeane tu dawa upeane. It is not right. It is not right. Yeah, let me just tell you the truth. It is not right because you could be overdosing that baby. So what you're supposed to do, it's either you can either get someone who has the knowledge. If you're not getting someone who has the knowledge, make sure that the dawa that you're giving, it has an insert. Inakuwaga na insert yenye imeandikwa mtoto wa hii age, maybe from 2 to 5 years, you're supposed to give 2.5 ml. Don't exceed that. Ama mtoto from maybe 5 years to 10 years, you're supposed to give 5 ml 3 times a day. Please don't exceed that. If you're not sure of what to do with medicine, please don't do anything. Medicine is poison. That is a fact. Medicine is poison. If you don't take it the right way, it will end up harming you instead of helping you. So the other thing is about the herbal medication. Okay, fine, sorry. I'm there for that time that God will give me time. I'm there. Maybe I can be called if there's any problem. Myself, I'm a pharmaceutical technologist, so I can assist in that area. So again, maybe about now the herbal medication and maybe these other medication, as I've said, there are also those herbal, there are those herbal doctors. They are also licensed. They also do their research. Wanna come up maybe with their herbal medicine. Kuna wale tunajua their license, and their medicine is still okay. We are not saying that they are wrong. But now, the wrong thing is to take the herbal and these other medicine. Because of what I've explained as interaction. There could be interaction between this herbal medicine and these other medication, and it becomes toxic. By the end of the day, it does not help you. Hata kama umeambiwa hii inasaidiaga na pressure, you still take something else that is helping you with your pressure. You don't know what interaction they are causing in the body. So you're not supposed to take them together unless maybe the doctor has told you, now when you're in this line, you can combine with this. Maybe they'll work together, they are good. But if not that, please don't go to the herbal doctor and to this other doctor because you're treating the same condition. That is wrong. And I can assure you that herbal medications are very okay. I have an auntie, she passed away some times back. She used to hail from Rimuru. And she was diagnosed with cancer a long time ago. It's a story that I hear. She passed away some few years ago. And when she was diagnosed with cancer, she did not go to these to artificial medicines. She went to Morogo. There was that famous, I don't know whether he's still there even up today, I don't know. That is where he used to get her herbal medications from. I could see he used to do a ngano and I squeeze. I don't know, so many other things that she was advised to use for that cancer. It was a breast cancer. And let me just give a testimony because my auntie, she was diagnosed with cancer. That's a story I had. She was diagnosed with cancer when she had her second-born baby. But she was able to go up to the 7th born, and she was just breastfeeding one breast. The other one, she was not breastfeeding, she was cancerless. And she lived with that cancer for around 47 years. So the end, sasa zile siku zake za mwisho, that is when now she went to the hospital because like every other organ failed in the body. So hakuna vile angekuwa managed at home. She was taken to the hospital during her last days. But so I just want to show you that even the herbal medicines, I've seen they work. So if you're on the herbal medicine, stop, just concentrate on that, or make sure that the doctor who is seeing you knows what you're taking, so that it does not interact with the other medication. Any other question? Hmm?
You have said about the licensed herbal doctors, and you have these Masai's dawa ya kuosha damu. Yes, can you advise us on that?
Okay, about the Maasais, I know they have their herbals, as in, maybe that could be their tradition. They have those herbal medicines. But let me just, it's just a caution. Unajua hizi dawa Masai wanabeba, zimeshida huku zikichomeka na jua. Like maybe, hizo huku inje, maybe the condition is not good. You don't know how they have been preserved. So hauko sure, hata kama wanakuambia hiyo dawa inaosha damu, inafanya nini, hata haujui whatever is in that medicine. So hiyo, mimi nitakwambia tu to be on the safe side, mimi siwezi kukuadvise ukunywe hiyo inazururishwa huku. Unless maybe it's someone who you've been advised of someone who usually does those things, na mmejua ni mtu mwenye ana ujuzi wa hizo dawa. Lakini mtu tu akukuletea ukunywe kikombe moja, it could be toxic. Juu haujui hata hiyo dawa imekaa for how long, na maybe hana preservative, hana ile kitu ya kupreserve hiyo dawa ndio isiende. It could be right, maybe from wherever he got it from, but maybe akizururisha huku inaendaga, maybe inakuwa because haina preservative, maybe hakuna preservative ameweka, inaharibikia katikati. So for that one, I won't advise you maybe to take, unless maybe you know for sure it's from the right source, but that one no.
Kuna sijui kama hii ingine pia inaitwa habu. Hii ambaye iko na vyakula kama unasiagiwa, unablendiwa cabbage, unablendiwa waru, unablendiwa dania, unablendiwa ginger, unablendiwa ingine, alafu sasa unakunywa. Hiyo bado ni herbal ama hiyo ni nini?
Hapana, that is not herbal. In fact, that is something that is very good for your nutrition. You should take. Herbal ni zile indigenous trees zenye ziko huko zinaenda zinasiagwa. Those are the herbal medications. Lakini sasa cabbage, hapana, cabbage si herbal, whatever, si herbal. Even if it's that concoction that you usually take, okay, fine, they are still, maybe, okay, I don't know whether to classify them as zile ginger na garlic. That is still good. In fact, that is the best treatment for flu and cold. The first thing before you go to the chemist to get medicine, do that ginger, do that lemon and that concoction, garlic, and also honey. That is very good. Lakini sasa herbal ni zile miti za kusiagwa huko. Zile miti zinasiagwa so that they may become medicine. Yes.
Okay. Asante, nilikuwa nauliza hivyo kwa sababu tuseme okay, niko na ulcers na nimeambiwa nikunywe juice ya cabbage. Sasa nitajuaje kiasi gani ya cabbage ndio nitakunywa ndio hiyo ulcers ni? Nitakunywa kijiko moja ama sasa hiyo tena ni shida. Sijui kama kwa sababu hiyo ni shida, kwa sababu naweza kunywa vile unasema zaidi pia nayo tena ikue imelete madhara. Okay. Sasa sijui katika laini za madawa, kwa sababu again, apart from the herbal and now these artificial medicines, there's also this other thing that is coming up, and our people are going into that. That's why I'm asking. Our people are also going into that. Wakati wanaenda ambao wanatengenezewa miwa, wanatengenezewa dania, wanatengenezewa nini, how much of that is enough? That's my question. Yeah.
Okay. Okay, for sure. That one, the fact that these things, we know they are natural. Maybe usually our natural food ni zile vitu zenye tunakulaga na haziwezi to harm. If you can take like a full, ukarange cabbage half na uweze kumaliza yote, sidhani inaweza kukudhuru. So that one maybe, okay, though I'm not a specialist in that field, but my views are that these things, ini zile food zenye tunakula. So maybe hizo hazina harm sana kwa mwili. Unless, because they're just like maybe the normal food that you're taking. So hizo haziwezi kuwa na harm sana kwa mwili ukikula. So they cannot maybe give you the toxic effects of medicine, the artificial medicines or the herbal medicines. So hizo specifically maybe mwenye anakuadvise anafaa kukuambia sasa hii cabbage ukitengeneza ni glass moja asubuhi na jioni glass moja. So but that one maybe when it comes to side effect, hiyo sioni ikiwa na shida kwa mwili yako, kwa sababu these are the usual things that you usually take. Hata ukienda ukivunja miwa na huko utakula miwa mzima, yeah, I don't think there will be a problem with that, but just confirm from the source, because it must also has kipimo yake, like during the day what you need. It's like maybe when you're on diet you're dieting, so kuna pia ile kipimo ya when you're doing the diet, kuna ile kipimo unapeangwa in a day what you need to take for that specific day. Hivyo ndio nitasema. All right.
Swali langu ni moja ama mbili. Tukienda kwa hospitali tunapimwa damu, tunapimwa choo, tunapimwa makojo, tunapimwa temperature. Lakini kama huko Mama Wambui amesema unaenda unapewa cabbage, kuna kitu unaambiangwa sijui ushike, inalete maugonjwa hapo mahali wewe inaonyesha kwa computer. Is that thing true? Is it real?
Okay, sasa hiyo kitu nasikiaga iko. Mimi mwenyewe sijaipimwa nayo na sijaitembea hapo kupimwa nayo. What I can talk of is what I know is that in the hospital, when you go to the lab, you get the results, the true results for whatever condition you have. Lakini sasa hii yenye wanakuambiaga ushike hivi, for sure I cannot talk about it because I don't know about it. Na nikiwa hapa, maybe in the medical field, I can only talk of what I know because I'm dealing with human lives. Siwezi kuja hapa niwaambie juu ya kitu yenye sijui ama sina ujuzi. For sure I'll be doing something that is very wrong. So about that, maybe I can go and maybe seek more information, then I give you the feedback. For sure that one, I don't know how true that is. I don't know how accurate the results are. Mi nitakwambia tu ya hospital yenye najua that if you go to the hospital, they do for you the tests. They are just good, they are okay. Na wanafanyaga test depending on maybe ile how you have presented to the doctor, ndio naonaga maybe ile kipimo anafaa kukupima. It's not every time you go to the hospital unaambiwa utapimiwa hii ama utapimiwa hii. Ni kulingana na vile umepresent to the doctor.
Niko na swali kama mawili. Daktari, najua sisi tunaishi na neema hata kwa nyumbani. So swali yangu ni labda upate mgonjwa ikuje usiku wa manane, na hiyo ugonjwa ni maybe ni kichwa, inakuja na kichwa.
Sorry?
Hiyo ugonjwa ni kichwa na inakuja usiku wa manane. Alafu mimi sio doctor na sina experience, na niko na dawa zingine ziko kwa nyumba kama painkillers nini whatever, na unajua hiyo kichwa anakuambia anaumwa na kichwa sana, utafanyaje? Na ile nafasi huko na ile clinic ama ile daktari hayuko karibu, pia nafasi ni hiyo transport pia. So utafanyaje? Mgonjwa juu kumwachilia mgonjwa atazidiwa na tuache hata tukimwombea. Kuna ile maombi, nataka maombi na kwa neema. Sasa kuna ile nyingine nayo nataka doctor, naona experience. Utafanyaje juu mnatuambia tusimpatie tu mgonjwa dawa yoyote kama tujauliza daktari? Saa hii ni usiku wa manane, utafanya aje? Asante sana.
Okay, asante sana kwa hiyo swali. Okay, ile nilikuwa najaribu kuambia, if you have a painkiller in the house, and for sure you know this is a painkiller, this is Panadol, and someone has a headache, usishindwe kumpatia hiyo dawa saa hiyo, kwa sababu hiyo ndio kitu itampatia, itamrelieve for that time. Kwa sababu huwezi sema ati uko na Panadol hapa yenye unajua inaweza saidia mtu kwa kichwa, alafu useme mpaka nimfikishe kwa daktari kwanza. I would also advise that on maybe those mothers who have young babies, wale watoto wadogo, it is usually advisable maybe to have something like Calpol in the house, ama Panadol yoyote tu ya liquid, yoyote tu, kwa sababu huyo mtoto anaweza amka usiku akiwa na fever zenye ziko juu sana, na maybe penye unafaa kumpeleka hospitali ni mbali sana. So hiyo ya kumpatia that Panadol, it is okay, bora tu you know it is Panadol you're giving, so that maybe the following day when you're going to see the doctor utaweza kumwelezea nilimpatia Panadol usiku masaa kama haya, so that now the doctor can take it from there. Lakini usimwache kama uko na hiyo painkiller, you can just give. What I was cautioning is if you don't know what you're giving your patient, ama mwenye mko nao hujui ile dawa yenye uko nayo, usimpatie tu dawa yoyote. And then again pia nilikuwa na caution ya wale watu wako na maybe other ailments like diabetes or hypertension. Huwezi tupatia mtu dawa yoyote hivyo, na maybe ni mtu mwenye amekuwa na underlying condition, so you just need to give what that person needs. Unaweza fikiria unamsaidia ikuwe pia ndio itamdhuru zaidi. But if you have something like a Panadol, a painkiller in the house, you can give someone who is in need, but for sure you know that is a painkiller that you're giving. Yes. Okay, sasa, yeah, painkillers are very different and they usually treat different types of pain. Sasa, painkillers ziko categories. Nitawaelezea tu kwa njia ile tutaweza kuelewa. Painkillers, they treat different types of pain. Has it treat pain any painkiller can treat any pain. Like for headache, the best painkiller will be paracetamol. Paracetamol ni kama Panadol Advance, Panadol Extra. Those are best suited for those types of pain. Lakini maybe if it is the joint pains or the muscle pains, joint pains most, to be specific, the best painkillers are diclofenac, because there are those, kuna zile zenye zita take care of the inflammation, kama hizo diclofenac, lakini Panadol haina hiyo uwezo ya take care of the inflammation. So painkillers, they treat different types of pain. They are suited for different types of pain. Not all painkillers zinaweza treat the same thing. Kama Brufen, it is in both, it can be in both side ya Panadol, na it can be in both side ya diclofenac, because it has the both properties, like it is an anti-inflammatory, it can also be for fever, for pain. So hiyo inaweza treat kama both, but maybe something like Panadol, it can only cater maybe for those maybe headache pains, but maybe hizo arthritic pains, Panadol haitaweza. Maybe you need something like diclofenac. There are different painkillers for different types of pain. Na kama ni tumbo, kuna kitu napeagwa inaitwa Buscopan. Tumbo inakuwaga ni spasms, like tumbo ni kama muscles they are contracting, so you need to stop the spasms. So you need something like an antispasmodic, something like Buscopan. Hiyo inakuwaga pia hiyo class ya spasms. That is why when you have maybe a stomachache, utapewa Buscopan.
Yangu ni request. Unajua hiyo maneno ni ngumu, sijui palawati pala. Ningeomba kama unaweza tuandikia chat, tuambie at least hizi drugs ndizo over the counter, hizi ukienda unaweza nunua. Alafu painkillers at least kama tunaweza pata hiyo chat, that's a request. Ama vile tunaweza fanya tupate hiyo chat.
Okay, thank you for that. Yes, we will do that. Mungu atusaidie, we will do that.
Mimi naongea juu ya dawa suppressor. Umesema tunastahili kunywa dawa suppressor asubuhi. Na unajua hiyo dawa vile saa nyingine zinakuanga na makojo. Kama saa hii unaona kama umekuja kanisa mapema, huwezi kunywa juu utakuwa unatoka nje. Kuna njia nyingine ya kutumia. Alafu dawa zinastahili kunywa na maji ama na uji.
Okay, thank you ma'am. Asante sana kwa hiyo maswali. So nimesema dawa ya pressure ile wakati mzuri ya kunywa ni asubuhi, kwa sababu maybe during the day ndio utakuwa active, ndio pressure inatend kwenda high. But pia kuna dawa moja tu hiyo yenye inafanyaga mtu asikie kama kwenda haja sana, na ndio unaambiwaga usikunywe usiku kwa sababu utaamka sana. So it is specific. There's a role that is supposed to do. Yani kuna ile inafaa kufanya kwa mwili, kwa sababu inafaa kama kupunguza like maji kwa mwili, ndio sasa nayo inaweza kupunguza pressure. Ndio maana maji pia inatokaga sana. Kwa hivyo hiyo haina njia ingine. Kama tu umepewa hiyo dawa na inakusaidia na pressure, haina njia ingine, utaikunywa tu. Alafu dawa, it is advised that you take medicines not with hot water. Usikunywe dawa na maji moto, kunywa tu dawa na maybe room temperature water, kwa sababu dawa ukikunywa na maji moto sometimes kuna kitu tunaitaga denatured. Hiyo dawa ni kutengenezwa, imetengenezwa na kuna vitu zimewekwa ndani, na hizo dawa sasa ile umeiweka kwa maji moto inaharibika, inakuwa denatured. Ndio maana unaambiwa hata maybe dawa ukitengeneza ya mtoto ile ya kuchanganya na maji usiweke na maji moto, usitanganyishane na maji moto, juu hiyo dawa ni kuharibika, inaharibiangwa na hiyo maji moto. Like maybe those whatever is being used kutengeneza hiyo dawa inakuwa less active ama inakuwa deactivated, kwa hivyo haitafanya kazi vile inafaa. Okay, kunywa na uji haina shida because uji tu ni maji na unga. Maybe ita depend ni dawa gani unafaa kumeza na uji. Juu kuna maybe wale watu wazee wenye mtu haizi atashindwa kumeza dawa na maji, haina shida.
Just your advisors about tumeenda hosi, tumepimwa, maybe umeambiwa ukunywe hiyo cabbage ama umepewa madawa. Then after a week una feel mimi niko poa, nimepona kabisa. So most of us hapo ndio tunaachianga dawa. Hapo ndio tunaachia dawa na ni hivyo kabisa. So is it okay ama mtu tu aendelee amalize dozi yake, ama how can you advise us?
All right, so thank you again for that question. Sasa there are those drugs, wacha tuzite medicines, zenye haufai kukunywa ikiwa half dose. Na most probably ni antibiotics. Antibiotics, they're usually taken from 5 days, but there's one that is called azithromycin ama Citromax. Hiyo inakunywaga ile ilikuwa ya kifua sana sana wakati wa COVID. It's only for 3 days only and usually take moja tu kwa siku. Lakini kuna hizi antibiotics zingine you're told either to take for 5 days or 7 days or 10 days kulingana na vile infection yako iko kwa mwili. That is very dangerous. Kukunywa hiyo dawa siku 3 because you can usually feel umesikia vizuri alafu uone sitahitaji hizi zingine. That is what brings about resistance. Resistance ni kumaanisha maybe kuna strain yenye hujaguza kwa mwili na ita come up more strongly. Kwa hivyo next time you're giving that antibiotic haitafanya kazi. And that is why I try to explain maybe saa ile tulikuwa tunaanza, that is why drugs like antibiotics, they are so much controlled. Ni kwa sababu ya shida kama hizo. That is why usually advised if you're taking any antibiotic, you have to take for the duration, ama hiyo wakati wenye daktari amesema ukunywe ni lazima utamaliza hiyo dawa. Lakini kama ni hizi vitu zingine, maybe kama ni painkiller, you can take it when you're in pain. Hiyo hainaga shida unless maybe maybe you had a swelling ama you are hit, you have inflammation, that would need you to take it for a longer duration. Maybe is ku bring down maybe the inflammation or maybe the swelling, maybe, but for a painkiller you can take it when necessary. Hizi vitu zingine maybe if it's for the diet ama hizo za kukunywa, maybe whoever have advised you, they know the benefits. You benefit with it after how long? Because maybe ukiachia katikati pia inaweza kukupatia the desired benefits for whatever you're taking, hizo vitu zenye unakunywa. So if it's something that you also, maybe those things that you're making, if you've been given maybe to take them for a month, just do them for a month. It is still okay. That is fine. The most important point to note is that antibiotics ndio zinakuwaga na shida sana. Apart from these other, now I'm talking about maybe these other, hizi dawa zenye kila mtu amezoea. Wacha na zile za maybe these other conditions, zile zenye zina need long term treatment. Hizo huwezi achia dawa katikati. Maybe these long term conditions kama pressure ama maybe diabetes, hizo hutaacha dawa katikati. It is not advisable. It's only the doctor who is supposed to advise you. Ati now maybe we have been able to control your pressure. Sasa sahi maybe alikuwa amekupatia dawa 2, tutapunguza tukuje kwa moja. Maybe ukienda tena uweze maybe kuregulate your pressure, you're being advised by the doctor maybe on what to do for you to be able to regulate your pressure. So when you're going to see the doctor maybe hizo visit, daktari ni anawezaga kukuambia sasa pressure yako naona ina regulate na sasa tutanid maybe kukutoa kwa hii dawa. Ama aone kabisa maybe even if it's diabetes, you know, ile askari kuna vile you can manage with either diet or exercise, but kulingana ni ni which diabetes, because there are diabetes, there are two. Kuna moja yenye maybe ni inborn na kuna ingine maybe ile watu wakiwa wakubwa wanapata. So kuna hii yenye unapata na unaweza ambiwa na daktari, for this if you go and do exercise maybe and you check your diet, you can be able to bring this sugar down, you can be able to normalize your sugars. Lakini ni daktari tu atakwambia sasa kulingana na vile level zako za sugar tunaziona, we need to monitor for some time, then maybe we can put you off the drugs. But don't usiache hizo dawa kama daktari hajakuadvise. These pressure medicines or these maybe diabetes medicines, no, please usiachie katikati. And please ukienda kwa over the counter, I had forgotten that bit. If you're going to buy the drugs for those conditions over the counter, you need to have a prescription, a legal prescription from the doctor. That is what you go to present. Daktari anaweza kukuandikia dawa maybe kama ya miezi 3, anakuambia instead of coming back to the hospital, just use the prescription to refill your medicines. Unaweza enda tu kwa chemist fulani uambie nileteage hii kadawa. Please make sure that after every 3 months you're going back to see your doctor, ndio anakupima aone kama you're improving ama umefika wapi. Isikuwe tu like you're going to see the doctor after a year or after 6 months. That is when you're going back to see the doctor, akuambie sasa level yako iko aje. Please make sure that if maybe the doctor has given you permission, maybe you can refill your prescription after around 3 months. Make sure that maybe after every 3 months or after every 6 months, you're going back to the doctor, ndio akuelezee sasa tumefika wapi. Are we managing? Tunaweza acha ama hatuwezi acha, but usiache hizo dawa kabisa.
I was asking, is there a way or a routine you can use to overcome injection phobia?
Okay, yeah. Wacha tu nicheke kwa sababu sijui kama kuna vile for now, because I know that if you need an injection, injection, when you go to the hospital, injection unapewa ni kwa sababu of the severity, meaning ukweli you need to be acted on instantly. Na ukipewa hiyo injection, itafanya kazi haraka kushinda vile utapewa tembe umeze. So hiyo phobia ya shindano, hiyo sijui ama utakuwa tu unaenda kwa internet uone tu watu wakidungwa. But I'm not sure if there is a way of overcoming that. That's what I'm not very sure. But if you're told to get an injection, it's because of the urgency of the medication. Ndio maana daktari anataka kupatia hiyo injection so that it can work very fast in your body, ndio ikusaidie.
Naonanga sinda na mandaktari. Unaenda, unaulizwa ulianza kugonjeka lini? Sasa ni makosa nikijitibu kwanza nitafute story.
Okay, unaulizagwa ulianza kusikia ulianza kugonjeka lini, kwa sababu the doctor needs to get the proper history of your maybe of the symptoms that you've been having. It's not good to lie. Afadhali uende uambie daktari, enyewe daktari nimekuwa nikisikia hivi kwa muda, nimekuwa nikienda chemist, nimekuwa nikipata hii. Kwa sababu daktari from there will be able to make a decision whether you've been getting the right medication or the wrong medication. So sio vibaya. Nimesema over the counter medications are there because zina shorten hiyo process ya kukimbia kwa daktari every other time, and it is still okay for you to go and get over the counter medication. Ile tu kitu nimesema, if maybe there's something that is persistent, usikae sana nayo. Afadhali tu you just go and seek medical advice so that maybe the doctor can get into the bottom of whatever it is. So sio vibaya kwenda, but ukienda kwa daktari, just be honest. Tell the doctor what you've been doing or what you've been taking, if you've been on herbal. Daktari tu ni mtu tu kama wewe. So atakuelewa tu vile tu, hata yeye ni mtu, atakuelewa. Just go and be frank with the doctor, talk to them. Tell them, daktari, I've been feeling this and this, I've tried this and this, I've gone to the chemist, I've taken this and this, lakini bado sijasikia. Kutoka lini? Kutoka hiyo mwezi ingine ama kutoka hiyo mwaka ingine nimekuwa tu nikisikia hivi. From that now the doctor can be able to take the correct action. Maybe if it is investigations anataka kufanya, atafanya the right ones depending on how you have presented your case.
My question is, you said we can take medicine with the porridge. I like my porridge with milk, and I hear milk has some interferences with the medicine. Is it probably better if I put my porridge milk nikitumia medicine?
Okay, yes. Hiyo ile uji nilikuwa nazungumzia ni uji tu yenye iko na maji na unga. Lakini ile umeongezea maziwa, hiyo sasa itakuwa maybe kuna dawa zinakuwaga na interactions with milk. So sio kila dawa ama sio kila dawa itakuwa suitable kumezwa na hiyo uji iko na maziwa. Kama ni hiyo uji ya kumeza dawa, wacha tu ikue tu ni the plain uji, ile yenye tu iko na maji na unga. Lakini usiongezee maziwa kwa sababu kuna dawa zina interact na maziwa, kuna zingine zinakuwaga inactive ukikunywa na maziwa, so they cannot work in the body, zinakuwa maybe inhibited from acting. So maziwa pia, hiyo ni kitu inatagwa food drug interaction. Zinaweza, kuna chakula yenye hufai kukunywa na dawa zingine kama maziwa. So maziwa kwa uji, it's not very suitable kumeza dawa. It's not every medication that will be affected by milk, lakini kuna zile zenye zitakuwa affected.
I wanted to ask, kama mtu anaweza experience adverse effects akitumia external medicines, sijui kama ni medicine, tuseme kama probe na deep heat, will there be any adverse effects if they are used in excess?
Yes. Hakuna dawa haina adverse effects. Na hakuna mtu mwenye haizi pata allergies. It could be even when you apply that robe, instead ya kusaidia maybe unaona you have reddened, you have swelled. Any drug can have adverse effects. Kwa hivyo, na hautajua kama dawa itakuharibikia kama haujaitumia. Kwa hivyo ukitumia ndio utaweza kujua kama hiyo dawa itakupatia hizo adverse reactions. So hiyo sio kitu yenye hata mtu wa chemist atakwambia maybe ukitumia hii dawa itakupatia adverse reactions, kwa sababu it is your body individually. Kuna zile vitu wewe utaweza kureact on, somebody else will not react on. Any drug is capable of giving you adverse reactions.
You've come across somebody who has overdosed. Or is there like a universal method of doing first aid that particular individual?
Okay, overdosing is very risky in the house. Na hiyo, okay fine, there are different types of poisons zenye mtu anaweza ingest akiwa kwa nyumba, and there are different ways of managing. Na najua maybe ile yenye tunajuaga kila mtu ni mtu kama amekunywa poison akunywe maziwa. It depends with the type of poison ule mtu mwenye amemeza. So it's not every other poison yenye mtu atapewa maziwa. Kuna ingine yenye you're supposed to crush the makaa alafu akunywe ndio iende iabsorb hiyo dawa kwa mwili. So for now specifically I won't tell you a specific akikunywa hii ndio unafaa kumfanya, but the best thing that is an emergency, they should be rushed to the hospital. Lakini najua watu wanapeaga kwanza maziwa maybe ya kutuliza, but it is not everything that is suitable as maziwa ikipewa it will be good for that.
Nataka kuuliza, kuna rafiki yangu aliniambia hizi painkiller zote ziko na side effect. Ni kweli au?
Yes, it is true. Every medicine has a side effect. Na side effect, hakuna dawa haina side effect yake. Hata hiyo Panadol unakunywanga. Panadol, it's a very simple medicine, but if you going to do it in excess, ukunywe ile dosage yenye haihitaji, itakupatia side effect. In fact, if you overdo Panadol to great extent, it can cause liver damage. It's a very simple medicine, but it can cause liver damage. Hakuna dawa yenye haina side effect. So the best thing to avoid the side effect is to take the right dosage. Usikunywe dawa uzidishe ile dosi yenye unafaa kukunywa, because they are usually zimetengenezwa kulingana maybe na your age or maybe your weight or maybe kama ni mtoto wanajuaga kulingana na hiyo kiwango. Ukikunywa hii dawa haitakupatia side effect. Hivyo ndio dawa ziko, na si dawa zote tu zitakuwa na side effect if taken maybe vile hazifai, but if you take them at the right, I mean the way they are supposed to be taken, hazitakupatia hiyo side effect. Yes, but there are all obvious those that can give you maybe side effects, maybe kitu kama diclofenac. If you have ulcers, automatically hiyo tu utaanza tu kuumwa. Because it is contraindicated in that. If you take something like Brufen, Brufen, maybe those people who are asthmatic, hawafai kukunywa brufen hata watoto. You're not supposed to take brufen juu it precipitates ama inaleta hiyo inaweza leta hiyo asthma. So there are things that maybe you need to be advised from the point that you're getting medication from, and you also need to tell your provider kama kuna any condition yenye uko nayo. But any medicine has side effects.
Tuko kwa ile ndugu yangu pale anauliza mambo ya sumu. Mtu unapata unakunywa sumu, anakunywa sumu na unataka kumsaidia, na mimi kwa lugha mtaani nasikia ikisemekana maziwa ni mbaya, inagandisha. So unaweza tumia mayai ama nini?
Okay. Sasa, okay, for now, sitaki kuongelelea mayai. Juu sijui mayai itafanya nini after you have taken. What I know of is that, vile nimesema tu, I know of the charcoal that you can take, you crush and you take. I know of the milk. Lakini nimesema it's not every poison that is suitable. Unafaa kujua ni poison gani. Now of course wewe sasa vile everybody ako maybe a layman, hutajua kudifferentiate huyu mtu amekunywa hii poison kwa hivyo nafaa kumpatia hiki. Maybe the best thing is to get medical attention very fast. Hivyo ndio nitasema. Maybe utaweza tu mpatia hiyo maziwa, but maybe hujui ni nini ameingest. So you may not be able maybe to know if this was right or this was wrong thing that you are doing. But mayai siko sure.
Asante sana. Yangu ni kuuliza tu, nitakurudisha kwa uji. Kuna hii uji inapikwa, inasungushwa. Inawekwa jugu, inawekwa doma na kadhalika na gwashi. Sasa hii uji utatua device aje kuhusu hiyo uji? Kwa sababu hiyo combination hatujui wanaweka ratio gani. Na kuna watu pengine wanashukua, wanasikia kisukusungu. To advise on that.
Okay, thank you for that. Okay, hizo uji najua ziko. So what you're supposed to do, uji ndio ikuwe sana na benefit in your body. You're not supposed to do more than 2 or 3 components. Tuseme most probably 2 of them. Haufai kuchanganya unga mingi ati ndio ufikirie ndio itakusaidia sana kwa mwili. Kwa sababu hizi vitu labda tu zitaenda hata haujuzi ama upike, hakuna gwashe haitaiva pamoja sijui na nini na mbosho nini. So maybe hata unaweza pika ikue njugu haijaiva, gwashe tu peke yake ndio imeiva. Maybe ukikunywa hiyo uji inaweza kuwa haitakusaidia sana vile ulikuwa unafikiria. But I can say that if you don't know the components of whatever you're taking, please don't take. Just take what you're sure of. Alafu tena kama utachukua hiyo uji, okay fine, kuna vile wanachanganyishaga, but most probably maybe 2 to 3 components zikichanganyikana ni lakini hii naongelelea maybe uji yenye kama yenye tunanunuaga Kirinyaga Road, wale wanajua Kirinyaga Road, kuna vile wanakuchanganyishiaga hiyo uji, but usichanganishiwe like 6-10 components juu ati iko na hii. By the end of the day inaweza kukupatia shida, kwa hata hutajua ni nini imekuharibikia. Hata kama vitu kama njugu maybe for babies inakuwaga maybe strong sana, ndio naambia it's good, it's healthy. Lakini maybe huo mtoto maybe by the end of the day that will be too much protein in the body, inaweza hata mharibikia. Same to adults, maybe hii kitu zile vitu imewekwa, maybe kuna kitu moja tu component yenye itakuharibikia. So just take ile what you're sure of na yenye kitu yenye itakusaidia kwa mwili. Don't do so many components at the same time, because hata kuiva labda hata hazitaiva, zingine zitakuwa mbichi.
Yes. Asante sana. Mimi niko kwa hii chako. Ni ene.
Okay, sasa okay, tunajua tu ni makaa ya mti yenye imeiva, makaa ya black. Okay, hapo siko sure kama kuna mti inakuanga poisonous ikichomwa, because by the end of the day mti imechomeka kabisa. But makaa ni makaa hiyo yenye imechomeka. But for that one, let me not say for sure it's for every tree. Hiyo siko sure, but najua tu ni makaa ya mti yenye imechomeka ile ya black. That is what you crush, then you give mwenye amemeza poison. Please, maybe if you would need to ask more questions, Nico, I'm available if you have a question, or maybe I can just give my number. It's 0720 21 21 43. That's my number. My name is Betty Murugi MWAURA, and I'm saved. I love the Lord as my personal Savior. Thank you so much for listening to me. May God bless you, and may we know that God is our healer in everything. As much as we are doing our part, it is God who heals. May God bless you.